Ontario midwives are celebrating a landmark victory after a human rights tribunal ruled their work has been undervalued and underpaid based on gender discrimination. Joining us this morning is Elizabeth Brandeis. She's the president of the Association of Ontario Midwives. Welcome and congratulations.
Thank you, Anne-Marie.
It has been, just to set this up for people, 24 years since midwifery became regulated in the province of Ontario. Pay, however, was frozen for 17 of those years. So with this ruling, how long will it be before you start seeing some kind of equity? One estimate said that you would have to be paid 20% of an increase in order to even just match what's the comparison group.
In fact, we think that the gap is more like 48% at this point. Yeah, and what this landmark ruling did was compelled the government to sit down with us to really figure out an appropriate remedy for our compensation retro to 2005, and also to really put in place a mechanism to ensure that our pay doesn't fall behind in the future.
In 1993, the government used a pay equity analysis to set a midwife's rate of pay at 65% of that of a community healthcare physician's salary. However, over the next 20 years, the pay grew by 76% for physicians. Base salary for midwives increased by only 33%. So although you have this ruling, there are no hard and fast recommendations or regulations. So what is the next step?
That's true, but what the case really does is set the liability that governments are responsible to ensure that this kind of gender pay gap doesn't continue to exist and doesn't exist when they're setting up pay for other female-dominated professions. So while there isn't a specific ruling of a specific number, we're very confident that when an appropriate evaluation of the skills, effort, responsibility, and working conditions of midwives is set up and really a job evaluation happens, that the value of the work will be recognized.
One of the justifications was that training for a physician is longer, more expensive than that of a midwife. And if you just look at years in schooling, you can see where that argument comes from. What is your comment on that?
Yeah, an appropriate job evaluation that really looks at those differences is what we're asking for. So midwives have never said that we want to be paid the same as physicians, but like in 1993, it's a very appropriate comparison group. Because we have very overlapping scopes of practice, that's a good place to start. So midwives aren't saying that we want the same pay as physicians. We're wanting a comparison that makes sense, that values our efforts, that values our skills, and really looks at the impact of being a female-dominated profession in the healthcare system.
Not just midwives, but other groups who have experienced gender pay inequity are also watching very closely to see how this one's carried out. Thanks for being in the studio this morning.
Thank you so much.